Assalamu alaikum dear doctor. In this video, I am discussing approach to a child with neurofibromatosis type 1. So general inspection, what we look, the growth of the child. Is that any short stature or macrocephaly is present or not? Then interaction and behaviors of the child. Then we proceed with the focused examinations. The making diagnosis, some features, these are number 1 in skin, there is more than or equal 6 capillate spots, more than or equal 5 mm in prepubertal child and more than or equal 15 mm in postpubertal child. We look for axillary or any inguinal freckling, that is more than or equal 3 mm hyperpigmented spots. Look for neurofibromas more than equal or 2 or more than equal or 1 plexiform neurofibromas, that is pubertal age group. Then eyes finding of neurofibromatosis type 1, that is look for least nodule more than equal or 2 iris hematomas by slit lamp. Look for optic glioma asymptomatic in early disease. Any abnormal afferent pupillary reflex or visual impairment. Then 3 bones. In bones neurofibromatosis type 1 we notice spine, there is kyphoscoliosis or scoliosis can be present. In tibia there is pseudoarthrosis or bowing can be present. Number 4, presence of first degree relative with neurofibromatosis type 1, commonly mother or father, as we know that NF1 is an autosomal dominant disorder. Number B, then we looking for any complications present or not. 1, abdomen examinations. Possible there is renal mass, that is Wilms tumor, renal bruit, renal artery stenosis can be present. Number 2, check blood pressure, hypertension. Then I would like to complete my examination by number 1, asking about the history of seizure and learning difficulty. Number 2, asking about family history of neurofibromatosis type 1 if no bedside clue of first degree relative involvement. I would refer for proper eye assessment to look for least nodule or optic glioma. Presentation of the case example is that Ahmed is a 10 years old boy with type 1 neurofibromatosis as evidenced by more than or equal 6 capillate spots and axillary freckling. He is cooperative and well grown for his age, but I would like to plot his growth parameters onto the suitable growth chart. I did not see any neurofibromas. His spine is scoliotic towards the right side. There is no bowing or pseudoarthritis of the legs. Palpation of his abdomen revealed no renal mass. There is no renal bruit heard as well. I notice his mother has a few capillate spots and neurofibromas as well. I would like to check his blood pressure to look for hypertension. I would like to check his eyes to look for least nodules on the iris and abnormal afferent pupillary reflex with visual impairment suggestive of the optic glioma. I would also like to ask about history of seizure and learning difficulty. So this is all about the approach to a child with neurofibromatosis type 1.